Good morning. Today we're going to start to discuss the whole topic of hormone dysregulation. This is a real game changer for a lot of people. Women understand this a lot more than men, but our basic state of mental health is completely determined by hormone health. And women in their cycles, all that is determined by hormone health. Men's own stability and their ability to produce things, to function things, both men and women, to be able to absorb their nutrients is all dependent on hormones. Every cell function that we have in every cell of the body is dependent on hormones. So this is really a big subject, and it's one that everyone that has some kind of a chronic health issue going on has problems with. So this is Your Health Reclaimed, where we expose the roots of Lyme disease and chronic illness so you can finally heal. We help you to understand how those roots function in Lyme and all chronic illness so you can restore your health and reclaim your life. I'm Dr. Brad Montagne, a veteran functional medicine doctor. We commonly see people who have worked for decades with multiple other doctors, never got any help at all, and we get them healthy again. And the reason why that is, we just deal with root causes. We don't ignore the symptoms that everybody pays attention to, but we dig to discover what the root causes are, and then we test to find out exactly how to restore those, and that's going to change along the way. So let's jump into this. We have been looking at the progression of Candida leaky gut throughout the body and how that affects basically everything. So to back up a little bit and go over what we've covered already. The lining of the gut is lined with microvilli that looks like when you hold your fingers up in front of your face with your fingers extended. Your fingers represent the microvilli. The microvilli increase the surface area of the gut about 400 times. It goes from about 6 square feet to the size of a tennis court. The microvilli, they secrete a mucus, and that mucus fills the space in between the microvilli, caps over the top. That's where all of the healthy microbes live, inside of the gut. And those are primarily what does the digestion and brings the nutrients to the microvilli so we can absorb those. The flora, the microbes that grow inside of the gut lining there, they create every single type of hormone that we have inside of our body. So it doesn't make all of them, but it makes some of them. So that's a significant contribution to hormonal health, is just a healthy gut flora, because they're always producing their share. On top of that, whenever there's an inflammatory issue going on, that can be from medications. We covered NSAIDs, steroids, antibiotics, antifungals, some of the neuroleptic issues for mental health issues. All those create leaky gut, along with food intolerances, heavy metal toxicity, chronic stress, multitude of things cause it. Whenever that happens, the microvilli, it's just like you close your hand, make a fist, and just look at your knuckles. It goes from your fingers extended with making healthy mucus and healthy gut flora to just looking at your knuckles on your fist. Almost no mucus production. All the healthy floras wash down, and it's producing pathogens. Candida is one of the biggest class of pathogens there. It has 4 forms: a yeast form, a fungal form, fungoparasite form, and a mold form. As the gut starts to leak, toxins start to get through the gut lining. The way the gut's designed, all the things that are absorbed inside of the gut should go through the cells. But when you have all this kind of atrophy, holes open up in between the cells, and The cells also start having free radicals that blow holes inside of the cells. That allows toxins to get in. That starts an autoimmune reaction inside the gut lining itself, and that autoimmune response starts to destroy the gut lining even further, which makes those small holes into great big holes you could basically drive a Mack truck through. That allows all of these toxins to get into the bloodstream. The bloodstream out of the gut goes straight into the liver. The liver gets overwhelmed with all the toxins, can't hold them all, can't process them at all, and they go out systemically and start to create all these problems. So the toxins try and get out your secondary elimination organs, which is the skin. That's what creates all your rashes. Your lungs, that's what creates all of your things like asthma, respiratory distress issues, and a woman during her menstrual cycle. And that's one of the reasons it makes women's cycles so difficult. So the toxins don't get outside of those. They start to deposit in your fatty tissues, trying to hide. Well, all of the hormone-producing organs are at least 50% fat. And these toxins, they start to deposit in those fats. Two of the first hormonal organs that start to get affected is the adrenal and the thyroid. They're super sensitive organs. The toxins start to wipe those out. The literature is really clear that this is an absolute fact. I'm not making this up. And so let's look at one of those organs in this discussion. We'll look at one of the other ones in the next one. So I'll start with the thyroid because it's simpler in its interaction with the body, and it gives us a good model to be able to follow on all of the other hormonal dysregulations. So right at the base of the head, way down at the bottom of the brain, is an area of the brain called the hypothalamus. The hypothalamus, it reads all the circulating levels of multiple things that are critical for the body to be able to adjust to stay alive and healthy. Some of those things are hormones, your gases that are dissolved in your blood and your tissues, and your minerals. So in the hormonal thing, it reads the hormones and has a feedback loop that goes down a very short vein that dumps into the pituitary, which if you draw a line between right from the bridge of your nose straight back to your temple, right about where those connect is where the pituitary is. It's about a pea-sized organ. It's got a front and a back half, and it's what sends all the signals out to regulate all of your hormones. So the hypothalamus, as far as the thyroid goes, the thyroid produces an inert prehormone or prohormone called thyroxine. It has no biological activity whatsoever. And the thyroid doesn't produce anything with a biological activity. The thyroxine gets converted mostly in the peripheral tissues. Most of that conversion is in the muscles. A little bit of that's in the liver, a little bit of that's in the kidney. The bulk of that, like close to 75%, happens inside of the muscles. And the conversion from thyroxine to T4, T4 to T3, T3 to T2, T2 to T1, can go two ways. The normal conversion produces active hormones. The reverse conversion still registers in the hypothalamus as if it's active, but it has no biological activity. So one of the dysregulations of the thyroid has to do with toxifying the tissues in which the conversions happen. The more toxic those tissues, the more it tends to push the conversion into the reversed form that has no biological activity. But the hypothalamus is reading as if the circulating level will have a biological activity. So there's no way to correct this dysfunction because it doesn't auto-regulate as everything else does. The hypothalamus doesn't read reversed and normal. It just reads like, say, T4, for instance, or T3, for instance, but it doesn't measure a difference between normal T4, normal T3, and reverse T4, reverse T3. Automatic response in the regulating system to adjust for this problem. So it just keeps running. Whatever that circulating level is, if it's good, the hypothalamus just communicates to pituitary, attaboy, keep it up, you're doing a good job. If the circulating levels are too low, it says, hey, pick it up a little bit. If they're too high, it says slow it down a little bit. That regulating hormone is called TSH that comes out of the pituitary. So we go and look at the thyroid. If there's toxins starting to deposit in the thyroid, it can't produce its normal thyroxine, and it can't produce it in normal amounts either. So we have a reduction in the production of thyroxine, and the more prominent the toxicity level goes inside of the body, the more toxic the tissues where the hormone gets converted. So the higher the toxicity, the less thyroxine that will be produced. And what is produced, it will start to push the conversion into T4 into reversed T4. They haven't studied if reverse T4 can go to normal T or if it just pushes to reverse T3. A lot of things aren't studied because there's nothing they can do about it. They only study things they can manipulate through pharmaceuticals. So it leaves this great big huge void or chasm in the understanding of properly how to bring things back into normalcy, normal function, because there's no compensation to look for such things. So I think you're starting to see a major problem here. As the toxicity level grows in the thyroid tries to respond in a couple of ways. It'll create nodules in it. And I'm sure there's plenty of people out there that you know and you've heard of. They have nodules in their thyroid. They have no idea where they're coming from. And they don't have a good way to discern whether those nodules are benign. That means they're not a threat to health or a threat to the thyroid, or if they're carcinogenic, if they carry cancer. So a common thing that's done when they have nodules inside the thyroid is either they'll cut part of the thyroid out, which is insane, because then you have no way to produce things yourself. And they just say, that's okay, we will just give you hormones, you'll be stuck on hormones. But there's no regulation system with the hormones. And if you can't regulate it, then you can't regulate the function inside of your body. So it's a pretty common thing to either use radioactive iodine, which the thyroid collects, and the iodine nukes the thyroid to kill it, or they just cut a big section of thyroid out so that it's no longer a threat. Not knowing if there's anything really wrong inside of that nodule, then they send to the pathology lab, and it's a pretty consistent thing that there was nothing wrong with the thyroid in the first place. It just had these nodules. So once they either cut a big chunk out of the thyroid or nuke it to kill it, the thyroid can no longer produce thyroxine. Then you're stuck on pharmaceutical thyroxine. And they say armor thyroid's like your own. We've tested hundreds of people on their armor thyroid. It always dysregulates a large percentage of the metabolic functions in a large percent of the organs in the body, sometimes every single organ system. That lets you know it's not the same as what our thyroxine or 3, 2, or 1 are. It's different than what ours is. And that creates a really big problem because its responses in the body are now only regulated by what your medical doctor looks at your lab work with. And your medical doctor almost never measures normal T4, normal reverse T4, normal T3, and reverse T3. Years ago, I had a patient, as a female in her 50s, that had overt thyroid problems. You just look at her, she's a classic textbook thyroid problem. She's short, squat, she's obese, just round everywhere. She has a few wisps of hair. Low thyroid, you always start to lose your hair. She had some growth problems. When she was young, they amputated one of her lower legs and just put a prosthesis on it because legs were growing at unequal rates. That's another crazy thing. And she's in her 50s, had never had one menstrual cycle in her entire life. So I said, this is classic textbook thyroid problem. And your thyroid is 50% of the menstrual cycle. It literally controls 50% of the menstrual cycle. And the thyroid is responsible, dysfunctional thyroid is responsible for 60% of the miscarriages out there. So women aren't commonly told that when they're having cycle issues, and they always throw estrogen, progesterone hormones at it instead of look at the thyroid, and it's criminal. Years ago, we had a nurse call us up. She had just gone to her OB. She had been hemorrhaging for 2 months straight. She had done everything that she could. This was like a Wednesday. Gave her something to do and said, come back on Friday. We'll decide on Friday whether we're going to ablate, which means burn the inside of your uterus or cut it out. As she's going home, she talked to a friend. Her friend says, you need to work with my doc. She called me up. She turned around, came into her office. We figured out what was going on, gave her what she needed to address the problem. And when we're done, she asked me, so how long does it usually take you to be able to stop a woman's hemorrhaging flow like this? I said, usually within 24 hours. Sometimes that's up to 72 if the thyroid's a problem, but we already know the thyroid is a major part of the problem. We're already addressing that. So it's probably going to be about 24 hours. She looked at me kind of surprised. I said, I want you to come into my office on your way up to the OB. Come here first. That was late Wednesday night. And she was going to go that Friday to the OB. So that Friday morning, it's less than 48 hours later. So she comes in Friday morning. She goes, okay, what should I do? I said, why are you asking me? What's going on in your cycle? I went home, I started doing what you told me. I woke up the next morning, Thursday morning. I was only spotting. By noon, it had stopped, and I haven't bled or dropped since. And I looked at her and said, so why are you asking me what to do? And she's a nurse. And she's blinking at me. She's confused. I said, the whole reason you have your appointment with OB is resolved. And it didn't hit her till I said that. Why do you even need to go to that appointment, and why are you asking me what to do? The whole crisis that was sending you there in the first place is resolved. You don't even go to your appointment. And she didn't realize that till we talked about that. That's how critical thyroid function is, and that's how dramatic its response is to toxicity. So I'm going to jump from this the next time, and we're going to start to talk about how the thyroid interacts in the body. And this one's a mind blower because we have people all over the globe in all kind of aspects of healthcare and trying to talk the wrong thing of what the thyroid really addresses. And I'll leave this clue, which you're going to have to plug in next time to know how it does this, what is the mitochondria. So this is your Health Reclaimed. I'm Dr. Brad Montagne. We release these every Monday and Thursday. Put a like on this, share this with your friends, put some reviews up there so we can get the word out and get some people to listen to this. And if you need some help with your thyroid, get a hold of us. There's a link on a website where you can get a hold of us and we can resolve these things pretty well. So have a great day. Thanks. Bye.